Assalamu alaikum warahmatullahi wabarakatuh. Hi all, welcome back. Today we'll discuss the lung ultrasound diagnostic criteria of neonatal respiratory distress syndrome. Our objective today to know what the criteria of lung ultrasound of the RDS and to know about the lung ultrasound respiratory scoring system with lung ultrasound specificity and sensitivity for diagnosis in RDS. We'll start by normal lung. As you know before, normal lung should have normal regular pleural line, presence of lung sliding, and will define the A line with absent P line or P line in one sector less than 2 P line. So, any A line together with lung sliding assure that absence of lung pathology in the area of lung scan. Here, this is skin, subcutaneous tissue, pectoralis muscle, intercostal muscle, rib, this is rib shadow, this pleural line, this is A line. See, the pleural line is smooth, regular, well defined, and the A line. And this is the shape of normal lung by M. Moot. We'll talk now about diagnostic criteria of lung ultrasound of RDS. To diagnose RDS by neonatal RDS by lung ultrasound, we have 6 to 7 criteria. First one, a pleural line abnormality, either blurred, interrupted, absent, or thick pleural line more than 0.5 millimeter. We have bilateral white out lung, lower compact P line, uniform bilateral involvement, absent of A lines, consolidation. Should have consolidation. In mild to moderate RDS, we have subpleural and focal in nature. In severe RDS, is more widespread and deep. We have lung pulse in severe RDS, and you have pleural effusion. So, the following lung ultrasound signs are present in 100% of RDS. 100% of RDS. Pleural abnormality, bilateral white lung and disappearance of A line, lung consolidation. We have lung pulse in 80% in severe RDS, and we have some sort of pleural effusion 15 to 20% in patient with may have different degree of unilateral or bilateral pleural effusion. We'll talk about now more about lung consolidation because there is no diagnosis of RDS without lung consolidation. Lung consolidation is accompanied by air bronchogram, which is characterized by the following. Consolidation are most often observed in the posterior part of the lung. In mild to moderate RDS, it will be anterior consolidation or subpleural consolidation. In severe RDS, it will be deep part and lung fields. Consolidation are visible in different lung fields bilaterally. They may be limited to a certain intercostal space on one side of the lung. Consolidation show an even hypoechoic quality, and the boundary with the surrounding lung tissue is clear and easy to differentiate. Air bronchogram show dense, specklet, or snowflake-like shapes. The non-consolidated zone may be appear as alveolar insufficiency syndrome or AIS. Severity of respiratory distress syndrome. Mild to moderate RDS, we have lung consolidation limited to the subpleural space. If severe RDS, we have extended consolidation, more deeper to the lung fields. We have some 80% with the lung pulse. So sensitivity and specific lung ultrasound to diagnose it in the RDS, 100% for both sensitivity and specificity when we have ultrasound sign of lung consolidation, pleural abnormality with bilateral white lung and disappearance of A line. See, this is irregular interrupted pleural line, absent pleural line, interrupted pleural line, thick irregular pleural line. So we can not differentiate the pleural line from the lung here. We have consolidation. They have maybe some pleural consolidation, the subpleural consolidation, the deep consolidation. Once we have tissue-like syndrome like this, it will be deep, extended deep. This is AIS, this is white lung. So we'll talk about now respiratory scoring system. Each lung divided into three areas: upper anterior, lower anterior, and lateral. For each lung area, a 0 to 3 point score was given, total score ranging from 0 to 18. Sometimes we found spared area, defined as normal lung pattern, extend for at least one intercostal space in the longitudinal scan, surrounded by the area of alveolar interstitial syndrome or white lung. See, we'll divide the lung to the anterior upper and the anterior lower by the nipple line, and the lateral lung field from the anterior axillary line to the posterior axillary line is the lateral. So the one lung anterior 3 zone, 3 zone, 6 zone by 3 maximum score 18. See, the score 0 if the normal lung pattern, or P line 2 in less than 3 in the one intercostal space. Normal aeration, only A line or fewer than 3 is in P line. Score 1 if it is the more than 3 P line in the one sector, or the one sector have less than 50% of the P line. Score 2 if the P line, equivalent P line, the more than one intercostal space 3 or more, it is IS. Score 2, either with subpleural consolidation or without consolidation, is the score 2. The score 3 is this compact P line with extended consolidation. The same score. We'll divide the lung to upper and lower by middle level line with lateral view. Actually, we have another score divided to lung to 4 zone, not 6 zone. He divided all anterior, left and right is 2 zone, and all posterior, left and right. We make the score from 0 to 4. So the maximum score here is 16. The 0 score like the previous one. Also 1 score like the previous one. Here too, white lung without subpleural consolidation. If have IS with subpleural consolidation, it is score 3. If it is extended, score 4. So if they have full lung zone and all anterior, right and left, and all posterior, right and left, it will be score 16. This is the difference between the two scores. Now we'll go to the video part. See, this is the normal lung. This is skin soft tissue, pectoralis muscle, intercostal muscle, rib shadow, and this is pleural line, same regular, and this A line, this A line, A line, A line. If you know, but here this is lung sliding. This is true and from movement of the lung. It is normal lung. So it is if any scan from any zone found this is normal lung scanned area. We'll go now to the RDS. See, this is thick pleural line with subpleural consolidation. في compact P line, white lung, You can do differentiate the pleural line from the lung. It is thick irregular with pleural consolidation. White lung, thick pleural line. This is also white lung with subpleural consolidation. Irregular pleural line with thick white lung. Bilateral involvement. See? Subpleural consolidation, white lung. Here, mild pleural effusion with subpleural consolidation and white lung. If you look here, there is mild pleural effusion, subpleural consolidation. If you look the lung, it is lung pulse. It is moving with heartbeat. Moving with the heartbeat. Moving with the heartbeat is the lung pulse. So this is for today. Thank you.